Our School of Public Health is opening an Office of Public Health Practice here in the West End of Louisville. The individual who leads our community engagement initiatives is Dan Hall. Dan, let's give you a round of applause for everything that you do. As a VP for community engagement, this is now one of over 100 initiatives that the U of L is involved in the community. And I would opine that you can't be a modern-day School of Public Health unless you're doing the routine things that everybody has done in public health for years, looking at populational health, populational disease, but two other things really come to mind. One of which is being embedded in your community, and that's what today is about in this announcement. But the other thing is global health. And our School of Public Health and Information Sciences is doing both of those things. And today, we're putting a stake in the ground here with another initiative with outreach, or maybe you call it inreach, into the community here. Now, one of the things that's very important today in terms of the health of populations is looking at economic disparities and also healthcare disparities. And I know that Dr. Blakely will tell you more about this, but the school's intention is really to launch a series of pilot projects, looking at how those things interact. Education's a component of it also, and looking at how we can improve all of those factors, which we know leads to improved health in the long run. Health of people, individuals, families, and whole populations. So once again, welcome. This is a signal day for the University of Louisville, for Metro government with the mayor here, for state government, for federal government here with our representatives, all of whom have participated in this. And it's most important that I mention that this is part of our signature partnership. And this has been an initiative of President Jim Ramsey's for years. It's very important for the U of L to reach out and be part of the community, not just an ivory tower on Belknap or Health Sciences or the other campus, for example. So thank you very much, and without further ado, let me introduce the Dean of the School of Public Health and Information Sciences, Craig Blakely. Thank you.
Well, Dr. Ramsey was intending to be here, and I guess in his absence, somebody needs to say, isn't it a great day to be a Cardinal? So I remember I've been here about 2 years now, and I remember probably the second or third week I was here. I can't even remember who it is that introduced me to Sam, but I came over here and met with him in the old offices that they had over here that have since been reborn themselves. This was just kind of a shell coming together at the time. And Sam and I talked about, we painted a picture of an alliance that we intended to build to get the public health school really engaged in West Louisville as part of the university's signature partnership. And here it is, finally, here we are today, really getting this underway, and we're really excited about having a footprint right here in the Russell neighborhood. You could argue that this is in part just symbolic, but it's so much more than that, because it's going to force us to rub elbows all the time with leaders like Sam and his colleagues, and all of the community partners that are engaged with LCCC already. So we're really excited about how our Office of Public Health Practice right here on Old Walnut Street is going to be engaged in working closely with the community. Now, as you've heard reference from Dr. Dunn, and I'm sure that our colleagues are going to talk a little bit more about, the University Signature Partnership has been around for a while. You heard reference to 100 projects. We actually have a couple of projects underway here in West Louisville already, one of which is a violence prevention project, youth violence prevention project. And we also have an Affordable Care Act linked health literacy project in place, and Monica's probably going to talk a little bit more about those. So I'm grateful for the relationship that we've established with Sam Watkins, the president and CEO of LCCC. He's served on the board of the Signature Partnership with the University of Louisville for a long time. In fact, I think it was just a couple months ago that you stepped down. I think you were asked to come on board about 7 or 8 years ago for 2 years. And yeah, so that's how it goes. Once you get engaged, you get engaged. His mission clearly parallels a lot of our own with respect to concerns about West Louisville residents. Our health sciences faculty, students, and staff are working to become part of a collective contributing group to that solution. For example, the Northwest Area Health Education Center, or the AHEC, based in the Family Health Centers in Portland neighborhood, is involved in several signature partnership initiatives across West Louisville. The AHEC's goal is to improve the recruitment, distribution, and retention of healthcare professionals in medically underserved areas, and this is certainly one of those. In partnership with the Old Walnut Street LCCC, UofL students have recently begun assisting with things as even far off the beaten path as tax preparation services. Our Kent School of Social Work, Dean Singer is here today, has initiatives in place to provide social work practice opportunities for students and introduces best practice models and research capabilities right here in West Louisville. Our College of Education has signature projects in place at Atkins Academy for Excellence, at Portland and Cochran Elementary Schools, at Westport Middle School, and several other locations. We're excited to see how moving our Office of Public Health Practice right here to West Louisville is going to contribute to that collective impact. And as Louisvillians, we have a right to equal access to health, and we're confident that this is something that we're going to make a major contribution to as we move forward on this collaborative effort. So we're real pleased to be here. I now have the honor of introducing our Congressman John Yarmouth. I don't think there's anybody in the room that needs me to cite anything about where he's been and what he's been doing or who he is. So let me simply conclude by saying it's really nice to be somewhere where I can vote for a congressman that actually wins.
Well, I'm glad you can say that too. Thanks very much for allowing me to be part of this. This is, I won't speak very long because when you're following people who have MD and PhD and MPH and all these other things after their names, you know that they've said just about everything that's important to say. But what is so impressive to me is that we know, those of us who've been around a while, know the history of this neighborhood in this block, and this used to be an important center of activity in this part of our community. And obviously over many, many years, it fell into a period in which it was not utilized very well. A lot of businesses evaporated. But now I get to spend, and the mayor, we get to spend a fair amount of time in Russell, particularly recently, and we're seeing a lot of businesses open, and we're at a lot of dedications, and things are happening here. And this is such a significant part of that momentum that is occurring in this part of the community. One of the things that I get asked a lot these days is, what can I do to get involved in issues? And I say, well, basically you can forget about the federal government. Just, the federal government's not going to be much help. And I said, if you actually look around the country, the true examples of progress being made in the country now are happening at the grassroots level. They're happening in communities, they're happening in neighborhoods, and they involve partnerships. And I don't know of anything that better illustrates that trend than this project that we're dedicating here today. This is truly an organic project that will revitalize this neighborhood, will provide vital services, will enhance the academic program of the university, as well as the development of our city. So I want to congratulate all the partners involved. Dean, thank you for doing that. We look forward to great things. And if by any chance the federal government can be of help, I'll do my best. But you probably have to ask your 2 United States senators for that. They're running the show up there now. Well, one of them's running the show anyway. Anyway, thanks very much for letting me be a part of this. And now I get to introduce a gentleman who is, without question, the best mayor in the United States. And I will say that the more I talk to my colleagues and people on the national level, the more I'm hearing, God, you got a mayor who's really doing great things in your community, don't you? And I said, you're absolutely right. He's already been recognized as the top chief executive once of the mayors in the country, and I think they ought to retire that award. So it gives me a great pleasure to introduce my friend, partners in crime, the great Mayor Greg Fisher.
Well, thank you, Congressman. We have a mutual admiration society, so I appreciate the opportunity to work with you a great deal. But the partnership we're announcing here today is a huge win for the city because it connects so much of what we're trying to do here in the city with all of our different partners together in terms of a health and all policies approach, where every key decision that's made in the city, we want to make that through the lens of public health. How does it affect some of the issues that we're fighting today? It could be physical health, could be environmental health, mental health. How do our decisions contribute to this? And we can't be effective doing this as a city if we don't have great partners at the table making it happen. The partnership between the city and the University of Louisville in particular has some really deep and significant systemic roots to it. And a lot of people don't know this, but between Dean Blakely and UofL School of Public Health and Information Sciences, together with Louisville Metro's Department of Public Health, we jointly fund both our health equity director's position and the director of public health at the same time. So it's one thing to talk partnership, it's another thing to commingle our funds and energy for the city as well. And that's why we're delighted not only to have that partnership, but then also to have this presence here right in the Russell neighborhood of West Louisville. We have great optimism as well. I wanted to, for the future, for many different reasons, but I wanted to recognize a person that I see here, and that is our chief for community building, and that's who our public health reports to. She's not going to be with us that much longer, but has done a great job. And she's not going to be with us much longer because she's going to help the city even more as the incoming president of the Louisville Urban Leagues, and that is Sadiqa Reynolds, who's in the back here. So we're excited about that for the city. I'm excited about the work that's being done here at the Louisville Central Community Center as well. Sam, I think, this is the third time I've been here in about 10 days or so, making critical announcements about forward movement in the city at each time. And not just talking about what's going to happen, but saying what is happening right now. And so that is super important for the people of our city to know. And to kind of expand it a little bit, I mean, there has never been a more critical time for us in America to be trying to figure out what are the keys for healthy cities in our country. In particular, what is the key for healthy, deep urban areas in our country? We see the images on our TVs from Ferguson, from Baltimore. We know we can do better. And these are deep-seated, deep-rooted systemic problems that we have. They're economic, they're environmental, they're health-related. So it's important for us in our city, obviously, to be all in trying to figure this out and having everybody involved understand that, you know, we are imperfect people on this imperfect journey, but we've got to figure it out because we're all interconnected. And having the public health component so visibly present is a very, very critical part of that equation. So that emphasizes the significance of today's announcement as well. And then knowing what's going to happen between the city, LCCC, and UofL's Office of Public Health and Information Sciences as well is powerful. People trust these organizations, but there is nothing like being on the ground doing the work. You talked about it, Dean, or Doc, I can't remember which one, but saying we're going to be rubbing shoulders every day. Okay, all the work that we do in education, in government, it's a contact sport. Because we're dealing with people that have expectations that their hopes can be fulfilled, that they have some potential that they can realize. And if we're not working together every day with each other, it's just hard for that type of potential to come to light. And that's why physical presence is very important as well. So we're excited about that. And we're excited because there's a lot of movement going on here. The Congressman talked about that. When you take a step back for a moment and just say, well, that was just an individual announcement. Let me kind of add up some of the individual announcements that have taken place in the last 6 to 12 months here in Russell and West Louisville. Tomorrow, sneak preview, we're announcing 20 new market rate houses going up on Cedar Street at Quinn Gardens. At 18th and Broadway, we'll have a new YMCA on the east side of 18th, and on the west side, we'll have a new Walmart. Waterfront Park Phase 4 will be coming from like 9th to 15th Street on the river. That'll be about a $35 million project. Beecher Terrace Choice Neighborhood Planning Grant is underway with a partnership from Congressman Yarmouth's office at the Chef Space, which is the old Jay's Cafeteria. A kitchen incubator for new businesses is under construction as we speak right now. The African American Heritage Center, of course, has been a great, strong staple of the community now for years. And then we intend to break ground on the West Louisville Food Port next year as well, which will be an international beacon and gathering place for local food systems as well. So, I mean, that's all happening right here in Russell. That's as... So good things are happening. It's important that we talk about those good things and create that vision and reality of what tomorrow will bring us, because it can be a little tough when we're just focusing on the issues of today and yesterday, especially in urban America. So I invite everybody, please share that, if you will, and then ask people if they want to criticize, ask them what they're doing to help, and ask them how they can get involved. We can always use more volunteers at LCCC and many different places as well. But thanks everybody for coming out today, and this is a huge step forward for our city today. Thanks to all of our partners at UofL and Sam, your organization. Speaking of Sam, when you open a book and you say, what's a citizen leader look like? Sam's picture would be in there. Sam's not a flash in the pan. He's been doing this kind of work for quite some time. In other words, he's dedicated his life to helping the people of Russell and West Louisville reach their potential. And at the end of the day, we're all put on this earth to make it a better place. And the person that exemplifies in this community, as well as anybody, is Sam Watkins. Sam, thank you very much.
Thank you, Mr. Mayor, and you can see that we're trying to keep you busy with good news, and we're excited about all the prospects of our future and all the activities you just went through with us that suggest that Russell and West Louisville is certainly on its way. This is a very important announcement for us. We're not only excited about it, but we consider this to be a celebration. It's a great thing happening in West Louisville. I bring you greetings from a number of stakeholders that I see in the room. Certainly our board is represented here. Many people who have walked many miles and many roads to help us get to this kind of place in this part of the neighborhood and this city of Louisville is extensive. And many of you in the room here today, we always extend a warm thank you and appreciation for your help in helping us achieve what we have thus far. We know that the journey ahead is long and sometimes narrow and sometimes challenging, but it's also an exciting journey because along the way you have these kind of milestones, these kinds of celebrations, these kinds of successes that make all of that work worthwhile. I'm really thrilled to stand before you today and give some shout outs to some very important people that really reflect upon what the mayor's talked about in terms of leadership, but also in just commitment and energy around a cause and a purpose that's very special to a very special population, those people who choose to live in West Louisville. The first one I'd like to highlight is Dan Hall. Dan, you've been mentioned earlier, but I, as co-chair of the Community Partnership Board, appointed by Dr. Ramsey, know how important this university is to this great city, but more importantly, how important this university is to West Louisville. This signature partnership has brought about some great dividends. Investments continue to happen, and this is one example of that strategy of really making an impactful footprint in West Louisville by the University of Louisville. I cannot fail to remind you of how many West Louisville residents work at the University of Louisville. More than you realize. It's a large number of residents in West Louisville who has been employed for many years by the University of Louisville. So not only is it one of our largest, if not the largest employer, but it's a very special employer to residents who live in West Louisville. So Dan, thank you very much for not only your vision and your insightfulness in challenging us to move forward, and the results of your work is represented by what's happening here today. Thank you so much. Dean Blakely, I do remember that first meeting that you referenced at that old place that's now been totally rehabbed, and we're excited about that as well. And Mayor and I celebrated that just a few days ago and welcomed the entire community to what's now our new Family Strengthening Conference Center. But that day that we met, Dean Blakely, was really originated from Dan Hall, because he invited you to be a part of this community partnership board. And I remember so well you looking kind of gleefully eyed and said, you know, we're going to do something quite special here. You wait and see. We're going to really do something quite special. We're going to actually show by leadership what it means for the university to have presence in West Louisville. And here we are today. Thank you so much, Dean Blakely, for that vision and for that energy, and for you helping me believe that it could happen, because in fact, I was a little hesitant about what is he talking about, to have this school under Dean Blakely's leadership to be housed and located with her as a partnership, not as a tenant, as a partnership designed to create transformational change in West Louisville. Is not only exciting, but strategic. Thank you so very much. Mayor Fisher, I'm going to have to push back at you with your example of who and what I represent, as much as I appreciate that, but none other more than you represents what you described. This mayor challenged us, this whole entire community, almost 2 years or so ago, to begin to think differently, visionarily speaking. What is our future to look like? Let's go to work on trying to plan for the future. And we took up a challenge very aggressively, and the results of that is that we really are in a different place today than we were 2 years ago. We really are. Not only has my organization, under capable leadership by so many people, have really reinvented itself, but it also is driven by the notion that not only can it be transformational change, but it can be impactful change that can benefit one of the most impoverished neighborhoods in the United States, quite frankly. Now, we don't celebrate that. We don't pronounce that like that's some great achievement. We use it only to remind us of our purpose for which we exist. So at LCCC, we really believe that as a critical stakeholder, we accept that responsibility. We must lead by example. And so your leadership has challenged our organization to do more effectively, quickly, and engage people and make something happen for them. Thank you. We stand by that challenge, and we continue to work on that behalf. Thank you so very much, Mayor. Now, through this great partnership with the School of Public Health and Information Sciences, I believe we're going to talk about health differently than we have heretofore. We know all the indicators about West Louisville in terms of the health outcomes. We know the challenges of the mix of poverty and health-related issues that kind of go hand in hand. And so that says every fragile community that we have in our community of Louisville and the state of Kentucky, in fact, have the same kinds of impact issues that we're concerned about. Where there is poverty, there's likely some challenge around health. Where there's challenge around health, there's likely to be impoverished residents in our community. And that is unacceptable. And so when we talk about a different conversation about health, we hope and expect that we will make transformational impacts that has a public more informed about their health condition, but more importantly, is prepared to do something about it. Action, change, a different course of moving forward that is upon us. And I think we have capable leadership, and it's a wonderful person that I've met and got to know over the years, Monica Wendell. Dr. Monica Wendell, thank you for your leadership, and we're delighted to have you as a partner, but also as a good friend. Thank you so very much.
Thank you all for coming to celebrate with us today. We're so excited to be here and what this represents for us. Sam, thanks for hanging in there. The process took kind of a while, and we had some bumps in the road, but hopefully it'll be well worth it in the end. Congressman, Mayor, thank you for being with us today. I think that your presence definitely reinforces the importance of this partnership. So when the Office of Public Health Practice was established about a year ago, we started having conversations, and we wanted to locate our office in West Louisville because this is where we're working. This is where we spend our time. This community of West Louisville is important, and the people in this community are important. Dr. Martin Luther King Jr. said, "The time is always right to do what is right." And being here in this community, locating here for us, was right. We wanted our commitment to work with the communities and the neighborhoods that make up West Louisville to be marked by our presence in that partnership. So you've heard, I think each person has kind of touched on the importance of partnerships, and partnerships really are at the heart of making communities safer and healthier for everyone, and I mean everyone in the community. I love that looking around the room, I see lots of the partners that we've had the privilege to work with in this work. But as Craig mentioned, being here isn't just symbolic. Being here for us is practical because there's a lot of work to be done. And so our team has been working hard on several projects that I'll talk about very briefly, as Dr. Blakely alluded to. All of those projects focusing on social justice, social and racial equity, which are at the heart of health equity, and all of them focus in some way on the people that live here in West Louisville. So I'd like to introduce our team, and then I'll mention each of the projects very briefly. I'm going to make you guys stand up so you can, people can see who you are. So Ms. Monique Ingram is the director of the Office of Public Health Practice. Mr. Trinidad Jackson is one of our program coordinators. And I will mention Dr. Ryan Combs, who's also one of our program coordinators. He couldn't be with us today because his wife just had surgery yesterday, so he's taking care of family, but he's with us in spirit. And then we also have 3 doctoral graduate research assistants, Ms. Billy Castle, Mr. Gabe Jones, and Ms. Nita Ali. So one of my mentors told me a long time ago, the best thing that you can do when you're doing a job you love is to surround yourself with people who make you better. And I will say 1,000 times over that this is the best team I've ever worked with, and they make me better. So as I mentioned, partnerships are really kind of at the core of improving the health of communities, and we have had the opportunity to partner with a lot of different organizations in several projects that we have going on. So I thought I would just mention the projects very briefly, and then we'll take questions if you have them. So we've had the opportunity to actually join the Mayor's Office of Safe and Healthy Neighborhoods, and I saw Anthony somewhere. He's hiding in the back. And his team, Louisville Urban League, and the Interdenominational Ministerial Coalition, and also 5 of the neighborhoods in West Louisville on their Zones of Hope initiative. So Zones of Hope is funded by the James Graham Brown Foundation, and it's also part of the bigger One Love Louisville strategy. The project focuses on promoting the success of Black men and boys through education, job opportunities, and creating ways for them to be engaged in the community. Closely tied to that is a project that is kind of near and dear to my heart, which is our West Louisville Photo Voice project. So we've been working with West Louisville residents and people who work in organizations that serve West Louisville, having them take pictures around the community and tell us about those pictures, tell their stories to help us understand the perspectives and the experiences of this community as it relates to justice, safety, hope, and racial equity. So we are really looking forward to being able to share these pictures and these stories back with the community, and also being able to have them exhibited at the Muhammad Ali Center next spring. We have 2 health literacy projects that are actually kicking off this fall. One is aimed at creating usable health literacy materials and relevant resources regarding how to navigate the healthcare system, and also how to use health insurance. You know, I have worked in public health for a long time, and people always talk about you don't know what your health insurance covers until you need the service. And for a lot of people, if they've never been insured and now with the Affordable Care Act they're insured, just being insured doesn't equate to access. Just being insured doesn't mean that they're able to get the care that they need, because using health insurance can be kind of complicated. And so what we are trying to do is work with the community to figure out how to get the right information in a usable way to people so that they can get the right care in the right place at the right time, so that they can get healthy and stay healthy. And then we also have a second health literacy project kind of adding on to that seeks to increase health literacy around a few high priority health conditions in this community. So our last project that I'll talk about, Dr. Blakely mentioned, which is the Adolescent Diversion Project, is a partnership with the County Attorney's Office, the Office of the Public Defender, and the Juvenile Court to divert youth from the justice system and provide them with intensive mentoring by trained UofL undergraduate students. This project is actually scheduled to kick off in January, so we're recruiting and working out the kinks right now. The Health Literacy Project and the Adolescent Diversion Project have been funded by our partners at Kentucky One Health and the very generous investment that they made in the School of Public Health and Information Sciences for the Commonwealth Institute. And the additional health literacy project is being funded by the Jewish Heritage Fund for Excellence. So we appreciate the partnership of people in this community that are willing to invest in making the community a better place. So as you've heard from everybody, there's a lot going on in Louisville. There's a lot going on in West Louisville, and there's a lot of work to be done. And I say on behalf of our team, we feel very blessed to be able to work with people across West Louisville and Louisville Metro who are passionate and committed to social justice and committed to equity. And we look forward to continued collaboration to make this a great place to live for everyone. Thank you.